Now, what happens in the pathogenesis that red blood cells are destroyed? They are destroyed in two basic ways. Number one, they are destroyed by the merozoites, and number two, they are destroyed by the spleen. So, the spleen destroys the infected red cells. So, red cells are destroyed by merozoites and the spleen. And then what happens that the spleen is enlarged. Why? Because what happens that the lymphocytes and the macrophages enlarges, their hyperplasia occurs, which leads to the enlarged spleen. And they have written that plasmodium falciparum is more square than the others. And then what happens that the capillaries become occluded with the parasitized red blood cells. More and more red blood cells are infected, and what happens that if this is a capillary, it will get filled with these infected blood cells, and necrosis and hemorrhage can occur. And this can also lead to the cerebral hemorrhage, which is called as cerebral malaria in the brain. And this can cause extensive hemolysis and kidney damage, hemoglobinuria. And there is one another point, clinical aspect, that dark color urine is produced, which is also called as black water fever. This is very important. The hemoglobinuria can lead to acute renal failure, and acute renal failure can also occur. So now they have written that there is 72 hours of the fever cycle for Plasmodium malariae and 48 hours for other plasmodia. Now what happens that Plasmodium vivax and ovale and falciparum, these three forms the tertiary malaria, means that the malaria in them recurs, the symptom recurs after 3 days. And in but the plasmodium malaria causes quartan malaria. In this the symptoms and the fever, chills, etc. recur after 4 days. And what happens that the plasmodium falciparum infects red cells of all ages, but the plasmodium malariae infects only mature red cells. That is why it causes lower number of parasite growth, etc. And p vivax only infects the reticulocytes. This is important point. Now now comes that what is basically the protection of, or what kind of people are protected from malaria. The people which are having sickle cell anemia are protected against malaria because their ATPase activity is very less to support the growth of the parasite. The people having G6P, means glucose 6 phosphate dehydrogenase deficiency, which is an X-linked hemoglobinopathy, and Duffy blood group antigen deficiency. Duffy blood group antigen is basically um, a receptor for P vivax. So if this is deficient, then P vivax will not cause the disease. And now comes that the transmission of malaria is basically transmitted by the mosquitocytes, but it can also be spread by the crossing the placenta, or by the blood transfusion from the infected person to the non-infected person, and by the intravenous drug use also can also spread by this. And there is another point which is called as premunition. Premunition means that low level of parasitemia which results in low grade symptoms. The symptoms are not severe, so this is called as premunition. So now comes the clinical diagnosis. As we have discussed before, that what happens that fever, chills, and headache and myalgias, arthralgias, etc. occur after 2 weeks of the mosquito bite, and the temperature can reach to even 41 degrees centigrade. Nausea, vomiting, chills, abdominal pain, etc., and sweating, etc. can occur. And we have seen that this splenomegaly, means the spleen enlarges. Why? Because it destroys many red cells. And the hepatomegaly also occurs. The liver enlarges and anemia is very prominent. Splenomegaly occurs because the spleen enlarges, spleen destroys many red cells, and also because the reticulocytes, lymphocytes, etc., they also enlarges. So the spleen has to enlarge to accommodate them. Then what happens that the malaria caused by P. falciparum is very dangerous. It is life threatening. If it is untreated, it leads to cerebral malaria and black water fever. Black water fever is due to the kidney damage, due to which black colored urine is formed. Now, the laboratory diagnoses include thick and thin Giemsa stain smears, and in the smears, what we see ring shaped trophozoites and crescent shaped gametocytes, which is particularly of Plasmodium falciparum, crescent shaped gametocytes or banana shaped gametocytes, and there is another pigment seen in the blood, which is hemozoin pigment, which is produced by the lysis of heme. And then comes the, if the blood tests are not positive or do not give the result, then PCR or ELISA test is performed. And there is another point that in Plasmodium vivax and ovale, infected red blood cells are snuffer's dots. These snuffer's dots are produced when the infected red blood cells are stained with Romanowski stain, and this is all. And treatment is done by chloroquine and primaquine.